Hello and welcome to the 8th episode in our MCA mini-series. In this episode, we are going to focus on capacity, including some hints and tips to support you in practice, as well as dispelling some common myths. Capacity is one of the very first things we need to be thinking about and recording when in practice. Before we start any type of intervention, we need to consider whether the person is able to consent, aka, do they have capacity to make the decision in question, whatever that decision may be. So what does the MCA tell us about capacity? The MCA tells us that we assess a person's capacity through a 2-stage test. But what's that? Let's break it down. Firstly, we complete what is called the functional test, which is made up of 4 parts. Can the person understand the information relevant to the decision? Are they able to retain that information long enough to make the decision in question? Can they use or weigh that relevant information as part of making the decision? And finally, can they communicate what their decision is? If a person is able to do all 4 parts of the functional test, then they have capacity to make the decision in question. If, however, they are unable to do one or more of the 4 parts, you move on to what is called the diagnostic threshold. What is the impairment of or disturbance in the function of the person's mind or brain? Note here that there does not need to be a formal diagnosis, but if you believe there is an impairment or disturbance, you must back this up with some evidence which suggests that. If there is no impairment or disturbance in the person's mind or brain, then they do not lack capacity through the eyes of the MCA. If this is the case, you need to identify what else may be at play. For example, is there a need to educate the person on the topic of this decision? Are there any concerns around possible coercion or control? If there is an identified disturbance in the person's mind or brain, then the next step is to identify whether that is the reason why the person is most likely unable to do one or more parts of the functional test. We call this the causative nexus. That the impairment or disturbance appears to be the reason why the person has been unable to, for example, retain the relevant information. So if the person is unable to do one or more parts of the functional test, and this is due to the impairment in the function of their mind or brain, then they are assessed as lacking capacity on that specific decision at that time. Let's take a look at some hints and tips. Remember that you must have reasonable cause to doubt a person's capacity. That's the first principle of the MCA. Do not make assumptions based on a diagnosis, for example. Remember that the person has to prove nothing. It falls to us as professionals to evidence whether the person lacks capacity for a specific decision or not. The basis which capacity is assessed is on the balance of probabilities based on the evidence that you have gathered. It is a myth that only certain professionals can assess capacity. Anyone with the knowledge and skills required can assess. Where it is an option, it is best practice that the person who knows the individual best completes or at least is part of the capacity assessment, as opposed to having somebody parachuted in just for a snapshot. Capacity assessment should be considered as a conversation with the person on a level which meets their needs. It shouldn't feel like an exam or a test for them. Take time to plan for the assessment wherever possible. Make sure you take all practicable steps to support the person to make the decision for themselves and evidence just how you've done that. Identify what the relevant information is for that decision and plan how you could provide that to the person in a way to meet their needs. Plan what questions you would need to ask, for example. This is principle 2 of the MCA. Be very clear what the decision is that the person is having their capacity assessed about. We do not make blanket judgments on capacity. For example, a person may have capacity for certain decisions, but not others. Capacity can fluctuate for a number of reasons, which could include the person being unwell, for example. Just because somebody makes what you consider to be an unwise decision That alone does not mean they lack capacity. That's principle 3 of the MCA. Only a formal capacity assessment can confirm whether somebody lacks capacity or not. Be careful that your own values and beliefs do not impact on your decision making. If you identify that the person has capacity to make the decision in question, but you consider them to be a vulnerable adult, that their decision is placing them at risk of significant harm or death, and you have concerns their decision making is impacted by something other than an impairment in their mind or brain, say coercion or control for example, it is not a case that we walk away and leave them to it. Locally, we have procedures in place for just these types of circumstances, which includes multidisciplinary meetings, the high-risk panel, and finally approaching the High Court if deemed appropriate and necessary. Use the capacity assessment templates from within the local MCA and deprivation of liberty policy. They are there to support you in ensuring you have recorded the assessment thoroughly. And finally, attend the MCA training pathway to gain more knowledge and understanding of the MCA and how to assess capacity. We go into a lot more detail. Thank you very much for listening. We hope you found this useful. We look forward to seeing you all next time. Take care.